Welcome to Georgetown. I'm Maggie Little, director of the Kennedy Institute of Ethics, and this is a MOOC on bioethics. What is bioethics anyway? It's a field that explores challenging moral issues in healthcare, the environment, emerging technologies. Some of the issues are brand new ones, from advances in technology that would have sounded like science fiction not too long ago, gene splicing, growing organs in a laboratory. Some are issues as old as the human condition itself, that we get ill, we face death, we give birth. You'll get a chance to learn from some of the world's leading experts on these issues. Faculty here at the Kennedy Institute, who've written the best-selling textbooks in the world, have taught thousands of students, from undergraduates to physicians, nurses, scientists working in the trenches. 7 faculty, 2 course fellows, 6 weeks. Together, we're going to explore some of the most compelling issues in the field. Are performance-enhancing drugs cheating? Is it ever okay for doctors to lie to their patients? What do drug companies owe to the world's poor? Are genetically modified foods a problem? How about genetically modified animals? And what about climate change and environmental justice? What do we owe future generations? Whoever you are, wherever you live, these are issues that affect all of us. Come join the conversation. We'll see you on April 15.
Hello. The question we'll be considering is, should the law allow doctors to administer lethal injections to patients who request them in order to put an end to their suffering? We'll be examining one of the most important debates in bioethics, the euthanasia debate. The debate involves a host of complex ethical, legal, and social questions. My aim is to give you a basic introduction to the debate, an overview of some of the main arguments for and against legalizing euthanasia. What is physician-assisted suicide? This is when a doctor intentionally helps a patient to commit suicide, that is, to end his or her own life. And a typical example would be when a doctor provides a patient with a prescription for a lethal dose of drugs, which the patient later takes.
My name is George Salem. I'm an associate professor and researcher in the Division of Biokinesiology and Physical Therapy here at the University of Southern California. So I'm interested in exercise. I've been studying exercise for the past 30 years and using biomechanics, force platforms, high-speed cameras to understand how exercise targets the musculoskeletal system. So our primary objective in the current study, Yoga Empowers Senior Study, is to provide information for instructors who are going to be designing programs for seniors. However, this information is also going to be very useful for the clinician or therapist so that they can design individualized programs for their patients. Yes, we believe yoga is good and has its place along with other forms of exercise, but what we want to do is make sure that the programs are tailored for the senior who may be participating in yoga for the very first time.
When peer staff are hired to actually serve as peer staff, to use their life experience to instill hope and to role model recovery and to help people focus on taking care of themselves, which is something we've never really tried to do much in behavioral health, is teach people self-care. Now we're seeing much better outcomes, and we're seeing less demoralization, more hope. We're seeing people becoming much more actively engaged in their own treatment and in their own recovery, in taking care of themselves. We're seeing empowerment, and we're seeing decreases in all of the bad outcomes that we've gotten used to, like fewer days spent homeless, fewer days in prison.
Scientists have taken a great interest in that, and there are now a number of published studies that investigate the impact of different forms of meditation on different parameters of attention. Cognitive neuroscientists have distinguished among a variety of different subcomponents or constituents of attention. So there is selective attention, for example, where we direct our attention to certain classes of stimuli and intentionally ignore others. There is other aspects of attention that involve being able to disengage from a stimulus that you're focused on and reorient to another class of stimuli.
So about 20 years ago, I found the field of bioethics. which is a field that asks philosophers, along with lawyers, public policy folk, medicine, nursing, medical anthropology, to come together to look at some of the most challenging moral issues and policy issues that our generation faces. Well, what do I mean by bioethics? So one of the ways I think about it is sort of what angels wouldn't have. So if you think about it, if there are angels, they're incorporeal, immortal. I don't know, I'm sure maybe they have incredible ethical conundra, trying to figure out their answers to moral questions. But it's not bioethics. So bioethics looks at ethical issues that arise in virtue of our biological nature, in virtue of the fact that we are embodied and not just minds, and that we have the kinds of bodies, that we are this kind of animal. It's a field that started in the United States back in the 1970s. And cast your mind back to history, this was a time of the civil rights movement, the time of the women's movement, when groups of people came forward with new voices to assert that they had rights that weren't being respected. And at just this time, another group came along and said, we're patients, or we're clinical research participants, and we have certain fundamental rights of autonomy that are not being respected.